difficult for me to speak about pharma because I come from the diagnostics and the medical devices world, so I can only speak for this segment of the healthcare industry. What I see as the opportunity is basically connecting the dots between the different stakeholders and the different technologies that there are out there. If you look at the medical devices industry, and if you look specifically at diabetes care, which is the therapeutic area which everybody thinks is mostly suitable for digital health or mHealth, what we see is that already today people with diabetes generate a huge amount of data. And the question is, with that investment that has already been made from the healthcare systems in order to generate that data, what else can we do with it, and how can we use that data in order to create even more value for the individual patient, but also for the healthcare systems. So basically we're looking at how can we use that data in order to improve clinical decision making for the individual patient, but also how can we use the data in a consolidated way to improve population management and workflow for healthcare systems. First of all, Eminence is a company of Roche. So it's an internal startup of a player in the traditional medical device field. I think that makes already a huge difference. So as Eminence, we draw from all the experience and all the knowledge that Roche has in the healthcare sector, and specifically in the diabetes care arena. But at the same time, being a startup, we develop things that are very innovative and out of scope of our traditional business. Also, Eminence is not only an app. The app for us, it's just one of the interfaces that we have with the patients. Eminence is a much larger ecosystem that is built on a published concept, which is called personalized diabetes management. It has been published by Ciriello. And Eminence tries to technologically enable that personalized diabetes care circle in a way that I haven't seen before. It is a challenge because on the one hand you come from a regulated industry and you kind of start to deal with a non-regulated consumer electronics industry. And obviously there are frictions between those two industries and how things work. But I think at Roche Diabetes Care we're a very good example, being a technology company in the diagnostics medical device area, on how we can cope with those challenges in development in the regulatory area. And what we're doing, as you see, is we're having internal startups in order to agilize this process.